What is your wish, Ms. Linda?
My wish is to attract or create my ideal relationship.
Nice. Who else wants an ideal relationship? Both hands. All right. She wants two. I know, and it's only reasonable to want it all, yes? Excellent. I'll just ask you, or I'm going to give out quick little ones and then we'll go back into it. How do you treat yourself? I'm going to suggest that the first thing that you do in order to attract the relationship that you want is to begin by treating yourself as you want to be treated in that relationship. Start there. And we'll move back into that later. What about you, sir? What's your wish?
My wish is for Monica's perfect health.
Ah, see now. Who else is wishing for somebody else? Who else tends to say, well, I want this for so-and-so or such and such? It's so very common. Are you married or just friends or, yeah? Yeah?
Not married.
No, but very, very close?
I think so.
Okay, nice.
I would call it an ideal relationship.
Wow, okay, so let's all go rub up and down on him. Everybody who wants an ideal relationship, let's have that rub off. I should have pointed out that we can't really wish for that which is outside of ourselves because we don't know why other people are having the journey that they are. I've noticed that, I mean, I've had multiple near-death experiences and all kinds of health adventures. And Monica, is it true that each one gives us some really challenging gift, some amazing gift? Have you noticed that the bigger the challenge, the bigger the gift? Me too. Has anybody else noticed that? Yeah. We can't change anything outside of ourselves, but often when we change that which is within us, stuff outside of ourselves change. Now, I'm not saying Monica's health is going to change, but I am going to invite you to this awareness because I think it's important. When we have a loved one that is critically ill or having some kind of massive challenge, do you worry about Monica?
Yes.
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 Does anybody else have oh no, they're not supposed to be doing this, having this, experiencing this, let me rescue them? We don't know why. But we do know that if it wasn't supposed to be happening, it wouldn't be. I know it sucks. I know it sucks.
Yes.
And I also know, correct me if I'm wrong, Monica, that the most enormous gift that you can give any beloved who's having a huge challenge, health-wise or otherwise, is not throwing the negative energy of worry at them, but using the feeling of worry and concern to focus light and healing on that person. Monica's doing this. Please don't worry, it doesn't help, does it? No, it doesn't. It only gives her something more to worry about because you're worrying about her and she didn't say, I can't tell him that I'm sick because he's going to worry. Yeah. What's your wish? The perfect health thing, right?
For the cancer to leave my body.
For the cancer to leave your body. I'm a psychoneuroimmunologist, which means I specialise in how the way we think affects our health and well-being. we're in the Centre for Spiritual Living, so I'm sure that you've already well and truly investigated the emotional causes for the cancer, yeah?
Not all the way. I'm still in shock.
Oh, so this is a recent thing?
1st of December.
That is a recent thing. Okay, so the first thing I'm just going to give you a couple of practical things. I want you to go and look up ldninfo.org. Low dose Natalstrin is, oh, I should have stopped. No, it's okay. Low dose Natalstrin is something that I suggest for a lot of my clients with autoimmune system challenges. It's so safe that the FDA approved it before they realised it could be helpful. And I know. It's not a drug. What it does is you take a wee bit of it every night before you go to sleep, and it goes in there and it turns off your immune system. And your body goes, oh no, my immune system's been turned off, and it ramps itself up. So that by morning it's raised, and no matter what kind of autoimmune system disease you've got going on, it can't touch you because your immune system is so high.
This is an herb?
No, just look up ldninfo.org. Yeah. What kind of cancer is it?
Pancreatic, was that metastasized in liver and spinal cord?
Right. Okay. And you're familiar with Louise Hay?
I've heard Louise.
Yeah, she's awesome, isn't she?
Yeah.
She's absolutely eye-poppingly, jaw-droppingly astonishing. Is everybody familiar with that incredible woman? Do you know how she got her start? Oh, she too had all kinds of cancer. And she also had a childhood that was brutal and filled with sexual abuse and every kind of abuse. And when she got cancer, she wanted to know, I wonder if the cancer's got anything to do with the abuse that I suffered as a child. So she went out and she did a survey to find out how many women with cancer of the female organs had been sexually abused. Who knows the figure? Take a stab. On a scale of 1 to 100? 50, 100? 100. 100%. It's not a coincidence. I'm going to deal with this now. For the perfect health people, thank you. I want you to imagine your body as a three-dimensional hologram with conscious, subconscious, and body. You've got a problem in the conscious mind, say resentment. This person is just, or the situation is, I'm just, there's nothing I can do about it. I'm just going to put it out of my mind. But the issue that we've created for our own personal health and development doesn't just split off into the ethers. Undealt with, it moves forward to a subconscious level where it manifests as dreams and stray thoughts. Deal with me now. I can't. I don't know what I'm going to do with this. I can't change it, okay? They're just a mongrel and that's all there is to it. I'm not going to think about it. Okay, fine. It has no choice except to move forward to a body level where it manifests as pain and dis-ease and disharmony. I'm in your face. Deal with me now. Resentment manifests in the hips and the shoulders. And the hips and the shoulders. But because we haven't learned that our body doesn't yell at us for no reason, we go, ooh, pain, I don't like that message, and so we take a pill. Might as well be turning off the fire alarm because you don't like the noise. And so the issue, in this case resentment, goes deeper and deeper into the body, and the drugs are now on top of it, and eventually it will manifest as cancer. And where the cancer is will tell you what the issue is around. So I've seen this miracle a million times. It never ceases to delight me. Deal with the emotional cause. The symptoms go away of their own accord. Deal with the emotional cause. And your body doesn't have to yell at you trying to draw your attention to it anymore. Deal with the emotional cause. And all kinds of what they call miracles, but it's actually just common sense, will start to occur and evolve in your life. Let's take a breath.
What would be the cause of pancreatic cancer?
Go and ask Louise what the pancreas means.